Well, new at 5 now, as more people get vaccinated here in Clark County, there are also some more questions. People are asking how the vaccine could affect their bodies. And 13 Action News reporter Jeremy Chen talked to some Valley doctors today to get some answers.
The COVID vaccines have come out quite rapidly since they were developed, and there are bound to be questions on how they could affect someone's body. I spoke with 2 doctors who explained a variety of things on how the vaccines could affect the body, from mammograms to prescription drugs.
More shots are getting into more arms in the race to vaccinate more people from COVID-19. It's leading to many questions on how the vaccine could affect them. One of them being concerns over swelling that's found on mammograms after getting the vaccine.
So it's really important now to ask the patient, have you had your vaccine? And which arm did you have the vaccination in?
Dr. Suzanne Ellied is an OBGYN and member of the Clark County Medical Society. She says about 10 to 15% of vaccinated patients experience temporary swelling and suggests people get their mammograms before getting their shot. If they do get it after their vaccination, she suggests telling their doctor and waiting a bit.
She probably should wait a month to 6 weeks from the mammogram from the vaccination before doing that mammogram.
She also says the vaccine does not affect fertility in people and says a new study shows vaccinated mothers could have COVID-19 antibodies in their breast milk, which could help their babies.
If they get a little bit antibodies, it's okay. They'll be protected.
If you're someone who takes prescription drugs and want to get the shot, doctors say continue taking your medication. UNLV health professor Dr. Brian Labus says a vast majority don't directly affect the immune system, with a few exceptions like chemotherapy.
So for people with some sort of immunosuppressive drug regimen, they need to talk to their physicians to find out what's recommended specifically for them. But for most people, it's not going to be a concern.
He also says Nevada isn't getting enough vaccines right now, with the main reason being the federal government is using old population data. With Nevada growing at a rapid pace, it would need more vaccines to be properly allocated. Dr. Labus says if that does happen, it doesn't completely solve the problem.
If you give extra vaccine to Nevada or another fast-growing state, it takes it from somewhere else. So there really isn't a simple solution to the problem.
Doctors suggest taking over-the-counter medication like Tylenol or Advil after you get your shot for the side effects rather than before, as it could affect your immune response. Jeremy Chen, 13 Action News.